My name is Brandy Whitmer, and I am currently a BSN student at Georgia Highlands College, and this is my focused video assessment. Jeremy has agreed to be my patient today, so I'm going to do my head-to-toe assessment on him. How are you today?
I'm good. How are you?
I'm good, thank you. So, can you tell me your full name?
Jeremiah Whitmer.
And can you tell me your full date of birth?
August 11, 1974.
And I've noted that Jeremy's speech is clear and that he is alert and oriented ×3. So what I'm going to do today, Jeremy, is start from your head and work my way down. So I'm going to start with inspecting your head. I'm noting that it is oval in shape and it is symmetrical on both sides, and that I'm going to assess your hair distribution. I'm also going to palpate the scalp, make sure there's no tenderness, no bumps or swelling, no lesions noted. You're not having any pain when I press?
No.
Okay. And I'm going to note that the hair is distributed moderately and there's no areas of lack of growth, no lesions, no bumps, no scars. And so now, Jeremy, I'm going to assess your face. So if you can just look straight at me, and the skin color is appropriate. It is pink and is warm to the touch. It is absent of any scars or lesions. And his face is symmetrical in size and appropriate for development. And so now, Jeremy, I'm going to test your cranial nerve 5. So if you could please close your eyes for me. And when I touch you with this cotton ball, if you could tell me on which side of your face I'm touching you and where.
Right, up on top. Left cheek. Left chin. Right cheek. Left forehead. Right chin.
So that is testing the cranial nerve 5. And now, why is it going to sleep? I'm going to test your corneal reflex. And Jeremy has appropriate response with blinking when touched. And now if you could, I'm going to test your cranial nerve 7. If you could smile for me, please. Good. Can you frown for me? Very good. Can you puff out your cheeks for me? Good. Can you raise your eyebrows? And then close your eyes real tight. And you can let your breath out. Good. So Jeremy's cranial nerve 5 and 7 are intact. And now I'm going to go ahead and do your eye assessment. So I notice I'm going to look with a light here real quick. So I can tell that your eyes are equal, round, and reactive to light with both direct and convergent constriction. So now I'm going to assess your hearing. So I'm going to inspect the ears, and I notice that they're the same on each side. They are the same skin color, appropriate, no redness, no rashes. And I'm going to go ahead and palpate the ears for any tenderness or soreness. Very good. Now, if you could close your eyes for me, Jeremy. And I'm going to make a noise in your either side if you could tell me if you hear me on the right or the left.
Left. Right.
Very good. So his hearing is intact, no difficulties hearing. And now I'm going to go ahead and take a look at your nose. I notice that the nose is symmetrical, it's free of any scars or deformities, no rashes. And if you could go ahead and look up for me, I'm just going to inspect your nares. And the nares look patent with no blockages and no trouble breathing. I'm going to go ahead and close either side of your nares and have you breathe in and out. Very good. Jeremy has no difficulty breathing through either side of his nose. So I'm going to go ahead and move on to the mouth. His lips are full and pink. No cracks or lesions at the mouth. If you could open your mouth for me, please, and stick out your tongue. Very good. I notice that the uvula is symmetrical and moves up and down when Jeremy swallows. The soft palate and the hard palate are midline. I notice that the mouth is pink and moist. Very good. And I'm going to go ahead and assess the 9th and 10th cranial nerve. So I notice that Jeremy doesn't have any hoarseness. Can you swallow for me? No difficulty swallowing. And I'm going to go ahead and test your gag reflex. Open your mouth and say ah.
Ah.
And Jeremy has appropriate gag reflex. And now I'm going to go ahead and test your cranial nerve number 10. So if you could, I already did cranial nerve 10 with the tongue blade, checking the gag reflex. But I'm going to take a look at your palatal arches. So if you could, again, open your mouth and say, ah. Very good. The palatal arches are intact and symmetrical with no swelling and no redness and appropriate in color. And now I'm going to perform the Romberg test. So what I'm going to do is have Jeremy stand up, arms at your side. And now what I'm going to do is to perform the Romberg test, I would have Jeremy place his arms out in front of him. Straight out, please. And close your eyes. And I'm going to note if I notice any swaying or difficulty with Jeremy maintaining standing upright. Very good. 1 minute is up, and I've noted that Jeremy has had no swaying, which is positive. Now I'm just going to assess your ambulation. If you could go ahead and walk towards the staircase for me, please. You can come back. And I'm going to note that Jeremy has a steady gait, no difficulty ambulating. Thank you. So now I'm just going to go ahead and assess your neck. So I'm going to inspect it if you could just look straight at me. And I notice it is symmetrical. I don't see any bumps, rashes, lesions, scars, or swelling. And I'm going to go ahead and palpate around the neck and check the lymph nodes and make sure I don't note any swelling, any soreness or tenderness.
No.
And so now I'm going to go ahead and test your range of motion. If you could put your ear to your right shoulder, good, and then put your left ear to your left shoulder, good, and can you put your chin to your chest? Great, and now if you could look up for me, and are you having any pain or tenderness or soreness with that motion?
No.
So Jeremy has full range of motion of his neck. Now I'm going to go ahead and check your carotid arteries one side at a time. Very good. And now I'm just going to go ahead and listen to your carotid arteries. With the bell of my stethoscope. And Jeremy has a regular rate and a rhythm, and I don't note any bruise. And I'm going to go ahead and listen over your thyroid. Perfect. So now, Jeremy, I'm going to go ahead and move on to your upper extremities. So I'm just going to inspect your arms. And Jeremy's skin looks appropriate in tone and color, no redness, no bumps, no lesions or rashes. I don't know any scarring. And do you know any tenderness or soreness when I'm touching you?
None.
Okay. Great. So if you go ahead and close your eyes for me, I'm going to touch you on either side, and you tell me which side you feel me touching you on.
Right. Left. Right. Right. Left.
So Jeremy has equal sensation on his arms bilaterally. And if you can, please, Jeremy, put your arms out in front of me, in front of you. If you could resist against my hands and push up. Good. And if you could resist against my hands and push down. Very good. And then I'm just going to check your capillary refill, which should be blood return after pressing on the fingertips in less than 3 seconds. And Jeremy appears to have excellent capillary refill with less than 3 seconds. And now I'm just going to go ahead and palpate your arteries. I'm going to palpate the right brachial. It's got strong, regular pulses. And now I'm going to check the radial pulses. It's got bounding radial pulses on the right. And bounding radial pulses on the left. And now, Jeremy, if you could put your arms out in front of me. I'm going to, and close your eyes.
The thing's not on there. Is it recording? It better be.
Yeah.
Okay.
I'm going to go ahead and close your eyes, and you tell me if I'm pushing your fingers up or down.
Up. Down.
Other hand, please.
Down. Up.
Very good. And so I'm also going to test your range of motion. So can you put your arms over your head for me? Good. And then can you reach your arms out to the side for me? Very good. Arms in front of you. And can you roll your wrists for me, please? Very good. And I'm also going to check your rapid hand movement. If you could flip your hands back and forth. Excellent. So Jeremy has full range of motion in his upper extremities, strong radial pulses, and excellent rapid hand movement. So now I'm going to move on to the cardiac assessment. So first I'm just going to inspect the chest. So I notice that Jeremy's chest is normal in contour. I don't see any swelling, no bumps, rashes, lesions, or scars. And so I'm just going to go ahead and palpate your chest, and I'm going to feel for a pulse. And in the cardiac assessment, it's important to look for clubbing of the fingers, cyanosis in the extremities, and any edema, which can indicate cardiac irregularities. And so now I'm going to go ahead and palpate. I'm going to go ahead and palpate for any pulsations or localized motion. So I can feel a regular rate and rhythm. I don't know any pulsations. No thrills. And now I'm going to go ahead and listen. First, I'm going to listen at the aortic point. And then I'm going to move over to the pulmonic. And then I'm going to go to the tricuspid area. And then at the apex of the heart. And again, Jeremy has regular rate and rhythm. And no, I hear a normal S1, S2, no S3, S4, or gallop, no murmurs, no regurgitation, and no thrills. And so now I'm going to go ahead and start the anterior thorax. So first I'm just going to inspect your chest. Sorry.
That's all right.
Okay. So first I note that I don't hear any wheezes, no difficulty breathing. Jeremy's rate and rhythm of respiration is normal. Depth and effort is within normal limits. So now I'm just going to palpate for any tenderness or fremitus. So and can you say 99?
99. 99. 99. 99. 99.
Good. And I don't note any abnormalities. His thoracic expansion is normal bilaterally. And now I'm going to percuss to listen. What I would hear is resonance would be normal. I'm going to percuss for any dullness or hyperresonance, which could mean air or masses. I hear normal resonance and a little dullness over the heart and some up over the spleen. And now I'm going to go ahead and listen to breath sounds. And take a deep breath for me. So Jeremy has clear, non-labored respirations bilaterally. I don't note any adventitious breath sounds. And I'm going to go ahead and move to the posterior. Oh, actually, will you just turn around for me?
Yeah.
Thank you. Fall off. So first I'm just going to inspect the back. And I note that Jeremy's is equal bilaterally. Can you take a deep breath for me? Good. Skin color is within normal limits. No redness, no rashes, no lesions, no scars. And I'm just going to note the equalness of his inspiration. Can you sit up straight for me, please, and take a deep breath? And I note that the thoracic expansion is normal. Very good. So now I'm going to palpate for any tenderness, crepitus, or fremitus. So do you have any tenderness where I'm touching you?
No. Yes.
All right, and now I'm going to check for fremitus. If you could repeat after me, please, and say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Very good. So I don't know any fremitus. And now I'm going to go ahead and percuss the thoracic, posterior thoracic area. And I would be looking for any abnormal sounds like hyperresonance or anything dull that would indicate any pneumothorax or masses. And now I'm going to go ahead and listen to the posterior breath sounds. Jeremy has clear, non-labored, even respirations bilaterally. I don't know any adventitious breath sounds and no crepitus, no wheezing, no rhonchi, no rales. So if you don't mind, Jeremy, I'm going to go ahead and do your abdominal inspection. If you could go ahead and lay back for me, please.
Head where?
Right there. Yep, around here. So first I'm going to go ahead and inspect the abdomen. And I notice that the skin is normal color. There is no rashes, no lesions, no scars, and no swelling. Jeremy's abdomen is slightly rounded. The umbilicus is midline and inverted. And so next I'm going to go ahead and listen for vowel sounds. And I'm going to start in the right lower quadrant, listening for up and until 2 minutes in total, until I hear vowel sounds. And over to the left upper quadrant. down to the left lower quadrant. And I'm going to go ahead and listen over the aorta. And then to the right renal artery. And the left renal artery. And Jeremy has positive vowel sounds, active vowel sounds in all 4 quadrants. No hyperactivity, no hypoactivity, and I don't note any pulsations over the arteries. And so now I'm going to go ahead and percuss. I'm looking for resonance, which would be normal, dullness over organs, or what could be masses. And hyperresonance could indicate air in the belly. And I don't know any abnormalities with percussion. So I'm going to go ahead and palpate. So I'm just going to give some light pressure. Start in the right lower quadrant. I'm going to go ahead and palpate the liver and the borders of the liver. And then I'm going to come over to the left upper quadrant. And then down to the left lower quadrant. And any pain or difficulty with palpation?
No.
Great. So, if you can go ahead and sit up for me, I'm going to assess your lower extremities.
Sit up for that.
So, first what I'm going to do is inspect the skin is free of any swelling, lesions, bumps, or scars. And I'm going to go ahead and check your pulses. So I'm going to check the popliteal pulse on the right side. It's got positive 2 pulses on the right. And positive 2 pulses on the left. Dorsalis pedal pulses. Strong pedal pulses on the right. And strong pulses on the left. And Jeremy, if you could close your eyes and tell me if you feel me touching you on the right or the left side.
Right, left, left, right.
Very good. And I don't know any swelling or bruising or any vascular issues. There's no redness or erythema. And if you could please put your left leg out to test your range of motion as high up as you can. Very good. And then push my hand like the pedal of a car. It's got strong strength and good range of motion on the left and the right all the way up. And push strong for me. Very good. And strong range of motion and strength on the right. And if you could please, I'm going to point your toes in one direction and tell me if we're pointing up or down.
Up, down.
Very good.
My temperature?
Prior to our evaluation, I got Jeremy's vital signs, and they were all within normal limits. And this concludes my physical assessment.